Anatomy. Can you see the slide? Anatomy.
Yeah.
Yes, ma'am.
So the term anatomy is derived from the Greek word temnion, meaning to cut. Anatomia meaning cutting or to cut open. So this is what anatomy means. So by definition, um, it is the science of structure and function of the body. Okay, so this how the structure, like where the nerves or the organs are placed and how the functions are related to each other. It includes those structures that can be seen grossly without the aid of magnification. So what are the structures that can be seen with the magnifying glass or microscope in a body?
Micro. With the help of microscope, we observe microorganisms. Small.
Yeah, but what are the structures in a human body that can be seen with the help of a microscope? Asim, I think you're not audible. Just write in the chat box. Tissues. So I can see my tissue, my skin. Skin is a tissue, right? That I can see with my naked eye. Very easy. So जब blood test होता है तो आप क्या देखते हो? Correct. So these are microscopic things which you need magnification to see. RBCs and WBCs. Other than that, your neurons, right? Any kind of cells, not just RBCs and WBCs, any kind of cells. So you can see with the help of microscope and not in the anatomy. That is not anatomy, that is microbiology and pathology. They are different subjects. Okay. Gross anatomy. What is gross anatomy? In a study of structures that can be examined without the aid of microscope and can be approached from either a systematic or a regional perspective. Like we can see it from top to bottom, that is systematic version of it, or a regional perspective. Suppose if we have a disease in a specific area, or if you want to examine a specific area, so you will examine just a region, not the whole structure from top to bottom. So this is gross anatomy. And microscopic anatomy, also known as histology, study of cells and tissues using a microscope. Okay. Anatomy. Anatomy forms the basis for the practice of medicine. So you said Asim tissue, but the cells of tissues, not just the tissues, right? Anatomy forms the basis for the practice of medicine. So when you know the structures, then you will know the disease, and then only you can prescribe the medicine. It leads the physician towards an understanding of the patient's disease, whether he or she is carrying out a physical examination or using the most advanced imaging techniques. Okay, so a physician needs to understand the disease, but before that, he needs to know the organs first. If he doesn't know, कि stomach में क्या fluids होते हैं, first you need to know the normal, what is there in the stomach, what is the stomach, what is the color of stomach, what is the weight of stomach, size of stomach, then how will you understand the disease, right? हम liver cirrhosis में liver shrink करता है, hepatomegaly में liver expand करता है. If the physician doesn't know the normal, then it is very difficult to know the abnormal. Anatomy is also important for dentists and all other involved in any aspect of patient treatment that begins with an analysis of clinical signs. So in dental, what clinical signs you can see? Can you just tell me that the patient has a disease or a symptom in teeth?
Then cavity.
Cavity, correct. So cavity is a term, but what kind of thing you will see in the patient that Namrata will tell and see कि हाँ इसके दांत में cavity हो गई है.
What kind of things means you'll observe bacteria?
Yeah, but you'll observe discoloration, right? Black हो गया है. Yeah, there's a hole, right? Calcium has chipped off, or layers are there is a digging of layer or a hole in the teeth, right? So these are the symptoms that will tell you that okay, now there's a need of treatment. Then methods of study. Anatomy can be studied in different methods: systematic, regional, surface anatomy, anatomical imaging, that is radiograph. So we'll go one by one. Methods of study. Regional approach. Each region of the body is studied separately. All aspects of the region are studied at the same time. So as I told you, that suppose now we are studying only the respiratory system, not any other system, or the digestive system, not any other system. And then we'll study all the things from where the system starts. Suppose in the excretory system, how does it go to the small intestine, then largest intestine, then how it is flushed out through anus, all these things. So these are studied simultaneously to relate. Then the systemic approach. Each system of the body is studied and followed throughout the entire body. As I told you earlier, you combine different systems in this. Suppose food is entered through mouth. Okay, so that is your oral system. Then it goes to esophagus. Okay, then it goes to your stomach, which is your digestive system. Then it goes to the other, then excretion. So when you study all the systems together, which you study in your graduation mostly, post-graduation mein to we study a specific thing, right? Can you just name me some specialities of MBBS courses or specialities
Like
of doctors?
pulmonologist,
Okay, which is the study of
lungs,
respiratory system.
respiration, then cardiologist, heart, nephrologist, kidney, neurologist, neurons,
Neurology with the
neurologist, this neurons,
nerves, right?
nerves, yeah.
Neurons,
Then
nerves, right?
biochemistry with biochemist, then microbiologist,
Yeah.
pathologist,
Pathology with the
pathology with the study about this, like what to say, blood test we do pathology under this RBC,
microorganisms, basically.
yeah, microorganisms, pathogens, and
Surface
radiology,
anatomy. Okay. Is written something. Orthologist. Okay.
oncologist,
And who's
cancer,
an orthologist?
orthologist में bones,
Okay, so he's an orthopedic.
pedics,
Orthopedic. Okay. Gynecologist, urologist. Okay. Correct. Okay, surface anatomy. The study of external form of the body.
Ma'am, can you
Surface.
see the slides? Only that slide is only coming
Which slide
149.
is coming?
149.
Okay, 149. I am on 154. Okay, just sharing again.
Okay, no problem.
Now you see?
Yeah. 154.
Yeah, it is a study of external form of the body, like the external surfaces. It means surface anatomy, the heading, right? And its relation to the deeper structures, that how the surface is related to the deeper structures. But the main object is to study the external surfaces. Then imaging. So uses radiographs, X-rays, ultrasound, MRI, CT, other technologies to create pictures of internal structures, right? And that is also a part of anatomy. You can see the anatomical structures, right? Though, see, what is in, do you understand the word invasive technique? Invasive and non-invasive. You understand these two words?
Ma'am, ingredients which will cut the body,
Correct. So
cutting,
in
surgery.
surgeries, or suppose in a mortuary, you know, you examine the
Postmortem.
body post-mortem. So these are the invasive techniques. You have to cut the body. Or biopsy is also an invasive technique. You're taking something out of the body, right? To check something. Whereas radiographs and all, they don't harm your body, they don't cut or extract anything from your body, right? So these are the non-invasive techniques. With the help of this, you can diagnose a disease as well as you're keeping the organs intact. You're not harming them in any way, right? Okay. Now, this next slide is visible. Regions. Visible.
Yes.
Where? Oh. Central
Like
region of the,
you are showing 154 slide.
can you see the region wali slide
Yeah, now I can see.
of the bodies, the head, neck, and the trunk, right? Trunk can be divided into thorax, the chest, abdomen, and pelvis, right? And see. Can you see the picture, the diagram?
No.
Okay.
Like you do the next.
Now,
Yeah.
okay. Just give me a minute. So, so the central region is divided into head, neck. As you can see, the head, the neck, and the trunk. Trunk consists of your thorax. Thorax is your chest, and your abdomen, and your pelvis. Okay. Central region is head, neck, and trunk. This is the This is the central region of it. Okay. So, thorax, abdomen, and pelvis. Pelvis is the inferior end of the trunk. What do you mean by inferior? Inferior word.
Inside.
Huh?
Towards the upper, towards the tail.
Inside the end.
Inferior. Superior, inferior.
Into tail. Tail. It means downward.
Correct. So, head, trunk. Trunk can be further divided into thorax, abdomen, and pelvis. Okay. Then, apart from the central region, you have the upper limb. What are the okay, it's written anyways, but okay. What are the constituents of the upper limb? upper limb में क्या क्या parts होते हैं?
Limb.
हाँ? पूरा arm, right?
Hand.
This is the upper limb. ये upper limb है दोनों और ये है lower limb, right? ये कौन सा
hand
portion है?
ma'am? Hand.
नहीं, hand is this. ये क्या portion है?
And that arm and forearm. So
हाँ.
form.
So ऊपर वाला क्या है?
That is forearm,
हाँ, और नीचे?
arm,
Correct. And this is the wrist and hand.
wrist,
Okay. And what about the lower limb? Lower limb में क्या parts है? ये क्या portion है?
मैम वन एक लेग रहता है,
हाँ, leg ये है. इसका ये क्या है?
thighs,
हाँ, ये this is?
that leg,
हाँ, this is
foot,
ankle
and yeah,
Hmm.
okay.
and this is the
Ankle.
foot. Right? Thigh, leg, ankle and foot. And then we have the spine and the back area. So these are the regions. Acha. Okay. And just give me different body parts here. Can you see the diagram? Regional approach.
Yes, ma'am.
Okay. Just see. कोई doubt हो तो बता दो. These are the anatomical terms और उनके जो layman terms है वो brackets में है. That would be easy for you to understand. हाथ और पैर के हैंड्स और लेग्स उसमें जो फिंगर्स होती हैं उनको हम डिजिट्स भी कहते हैं, राइट? डिजिट्स ऑफ हैंड एंड डिजिट्स ऑफ लेग, फुट. Okay, we'll move on to the next one. As you can see, the back side, the back portion.
Yes, ma'am.
Can you see?
Yes, ma'am.
Okay, okay. Just let me know if you have any problem. Okay. Anything you're not able to understand? Lumbar is the portion of the spinal cord. Sacral is a bone which is between the hips. We'll study everything. This is just the basic structure, anterior and the posterior. So the body is divided into anterior and posterior plane. Which plane cuts anterior and posterior?
Transverse,
No.
medial,
Means at a time, ma'am.
Yeah.
Means cut at a time the anterior and posterior.
Which plane
Say one
divides anterior and posterior into two
Forum.
planes?
forum and forum. I don't
Yeah.
remember that.
Frontal or coronal? Yes, correct. Okay. Sagittal is left and right, and transverse is
yes.
upper and lower, superior and inferior. Okay. जैसे स्टमक से कट करेगी ऊपर और नीचे बॉडी को, that is transverse. Now, subdivisions of abdomen. Would it be okay if we take this as the last slide for today?
yes, ma'am. Yes, ma'am, it's fine.
Actually, I thought I would take this class today, but I'm not feeling with it at all.
Take rest.
I'll compensate it, like if I'm not taking tomorrow in case, and I'll take it on Saturday if it is okay for you.
No problem.
Okay, subdivisions of abdomen. This is right upper, so it is divided into 4 quadrants: left, right, Left, right is further divided into upper and lower. So if you want to see the right upper quadrant, then left. So what are the constituents of the right upper quadrant? Can anyone tell me? Right upper quadrant में क्या क्या आपको structures दिख रहे हैं?
Liver,
Correct. Then
then the large intestine.
correct. Then
Intestine. Right upper. So stomach, half.
stomach नहीं दिख रहा.
So liver and
Small
large
intestine.
Yeah, small intestine is everywhere, no ma'am. This
Yeah. Just asking. Yeah, okay. And the left
and
upper.
pancreas. Pancreas.
Correct. Okay, I think now on left, right upper में दिख रहा है, otherwise it is the same. So now, again, it can be further divided into 9 regions. So 9 region again, in a more technical term, it is right hypochondriac region. Okay, the extreme right region. Like if you see the structure from, अगर आप अपना देखोगे structure, तो अभी तो उल्टा लग रहा है right. Your right is your left, है ना? When you are sitting in front of the screen, right?
Yeah.
उल्टा है ना, right or left?
Okay.
है ना? But if you see the same side, अगर आप वैसे ही बैठ जाओगे, so your left, extreme left upper would be the left hypochondriac, and the middle one, the upper middle would be epigastric, and then right one would be right hypochondriac region. Okay, so we'll start from the middle. Middle में सबसे ऊपर epigastric, then is umbilical region, then नीचे है hypogastric. फिर उसके बाद in your left and right you have the left and right hypochondriac region. Then again you have left and right lumbar region. Then again left and right iliac region. Iliac is a word सुने? I think this is something you can memorize. These are the 9 regions of the abdomen. Okay. Okay. I actually wanted to show you the videos, but I can't. I don't know. I can't see them. Chalo, it's an so body cavity. Cavity, just as you said, cavity is something hollow, right? Which can be filled with air or any kind of fluid. So can you tell me some body cavities which you think are hollow or can be filled with some fluid in your body? You have heard of some of the cavities?
Yeah.
What is it?
Ma'am, you're asking about the glands.
Not just glands, any kind of cavity in your body.
Abdominal.
Yes, abdominal cavity. Correct. And
Spinal cavity. CSF is present in the spine.
not able to understand.
Spinal cavity.
Spinal cavity, correct. Then nasal
Spinal
cavity.
Nasal cavity, yes. Cranial cavity.
Cranial cavity. Then
And thoracic, I know that's it.
thoracic cavity, correct. Pineal is actually a gland and not a cavity. And
Pardon?
any other cavity?
Heart, ma'am, in lungs also, like thoracic cavity, lungs is coming under thoracic, no?
Thoracic cavity, correct. It is coming under
Yeah.
thoracic cavity.
Even ma'am, lungs and heart, both will come or only lungs?
Heart is not a cavity. Okay, it has many valves inside
No,
it.
ma'am, in thoracic cavity, the location.
Thoracic is a cavity in that you have your heart, you have your lungs, ribs, and all these structures. So that is a big cavity. Okay.
Abdominal cavity is there
Abdominal
where
cavity. Yes.
digestive system will be there, then kidney.
Yeah, correct. So we have big cavities in our system in which there are structures. Okay, so I hope you'll understand. We'll end it today. Okay, I'll try to get the videos in the next class tomorrow. Okay, so that you can understand the previous lecture. And the different planes of the body structure. So I will get the videos. I did it today, but I don't know why they're not playing. I think there's some virus or something in my phone, in my laptop. Only the picture is coming. So guys, see you tomorrow.